Hi, I am Linda. In this video, I shall discover the foods that you should eat if you have arthritis. These nutritious foods are called anti-inflammation foods that reduces the pain and inflammation of arthritis. But first, I shall explain what is rheumatoid arthritis, which is a type of arthritis that attacks your immune system. It can be very challenging that can have a big impact on your daily life. Unfortunately, there are no cure for arthritis. This means that all you can do is reduce the symptoms of pain, stiffness, and inflammation. Also, you may feel tired all the time. I shall also explain the different foods that help with the arthritic symptoms by introducing anti-inflammatory foods and supplements in your meals. But first, what is rheumatoid arthritis? Rheumatoid arthritis, or RA for short, is an autoimmune disease that mainly affects the joints, but can also damage your organs. It is an advanced condition that worsens over time if not managed properly. Arthritis can attack the lining of the joints, called the synovium, which becomes inflamed. This inflammation causes joint pain, swelling, and stiffness. If left untreated, it can lead to joint deformity. It can also attack the immune system. In a normal system, it defends the body against bacteria and viruses, but in rheumatoid arthritis, immune cells, particularly T and B cells, become overactive. This overactivity leads to the production of inflammatory cytokines, which causes the chronic inflammation and joint deformity. The symptoms that you can develop with many types of arthritis could include joints becoming painful, tenderness, inflamed, and swelling. Other symptoms could be morning stiffness. This could last for hours. You could also feel fatigued and a general feeling of unwell. The joints that arthritis attacks could be your large joints that include your weight-bearing joints, such as your hips and knees. Also your small joints, these include your hands and feet. But with some types of arthritis, you may have complications with your eyes. You could have inflammation in your eye, or you could develop lung disease and cardiovascular problems. With everything, there are risk factors, and with arthritis the risks could include, if there are any family member with the disease, you are at a higher risk of developing it also. You could be at risk from the environment. This could be if you smoke, you should stop smoking straight away. You could have an infection or exposure to some chemicals. When you go to your doctor for a diagnosis, your doctor may ask you for your medical history and give you a physical examination. They may also send you to have an X-ray, MRI scan, and blood test. Your doctor may give you some drugs to help you to relieve your pains and inflammation, and send you to a physiotherapy, who will help you to exercises and keep your joints working. To date, there is no specific diet for arthritis, but by making a healthy choice, you can reduce the pains and inflammation. Studies have found that certain foods, such as anti-inflammatory foods, can help with inflammation. These can include: Number 1, oily fish like salmon or mackerel. Number 2 is nuts and seeds. The best ones are flaxseed, chia seeds, or walnuts. Number 3 is the type of oil to cook with. The best one is olive oil. The best fruit and vegetable to eat with fruit. The best is all types of berries, and the vegetables are sweet potatoes and all greens. And you should eat whole grain as it contains nutrients. These anti-inflammatory foods are rich in omega-3 fatty acids, also antioxidants that are full of anti-inflammatory properties that are good if you develop arthritis. To keep your joints healthy, there are foods that have collagen and protein that can help with having strong bones, tendons, and cartilage. These foods include bone broth, chicken, or fish. To keep your joints healthy, there are foods that have collagen and protein that can help with having strong bones, tendons, and cartilage. These foods include bone broth, chicken, or fish. Other foods that can help your joints include vitamin K, manganese, and sulfur. These foods can be found in cruciferous vegetables, garlic, and onion. When you develop rheumatoid arthritis, or IBS, which is another type of arthritis, it is an autoimmune condition. That means you should keep a healthy stomach and reduce the inflammation. The best foods to have for a healthy gut is to eat rich fiber, or prebiotics, such as garlic, onions, and bananas, and probiotics such as yogurt, kefir, or sauerkraut, can help with a healthy gut and reduce inflammation. Research has found that certain foods have been linked to increased inflammation. They include all processed foods like packed snacks, frozen meals, and pre-packed convenience foods. There are also refined carbohydrate foods. These are white bread, rice, pasta and pastries, candy, and desserts. Sugar and certain drinks such as soda. Also, you should avoid food groups that are called saturated and trans fats. These are red meat and full-fat dairy products. With my osteoarthritis and IBS, I go for gluten-free foods. That has helped. Nightshade vegetables is another group to avoid. These include tomatoes, peppers, eggplants, and potatoes, as they all contain alkaloids. You should also avoid additives and preservatives like artificial coloring, flavoring, as they all have sodium and sulfate which contribute to inflammation. Some people are gluten sensitive. I have inflammation with my IBS, which is another type of arthritis. If I have any gluten, my symptoms become worse, so I try not to go for gluten foods as much as possible. And lastly, drinking alcohol excessively can worsen your inflammation and therefore your pains and swelling. Also, it could cause fatigue. If you drink alcohol, you should drink in moderation. I know you are already in pain, but you should keep active and exercise each day. But before doing any exercise, you should consult with your healthcare provider. They can help you with a personalized program. I have noted 3 different types of exercises that your healthcare provider may explain to you. They could include: Number 1 is that you should always start slowly and progress steadily, increasing the duration and frequency. Always listen to your body and pace yourself. Number 2, the best exercise is low-impact exercises, which is gentle on your joints, and it can reduce the stress and strain of living with pain. These include swimming, cycling, water aerobics. Number 3 is exercise your muscles, particularly if you have rheumatoid arthritis. These can help to keep your muscles supporting your joint stability. They include your arms, legs, back and core. Number 4 is keeping active through the day, with short walks, or stretching, or reduce joint stiffness and improve your circulation, but you should also have periods of rest. And lastly, number 5 is to keep a notepad and write down which exercise you did, the duration, and how your body reacted with the certain activity. This way you can adjust your routine if needed. Managing arthritis day in and day out can be very stressful. This stress can lead to the symptoms of inflammation worse. It can also trigger pain, also fatigue. Some stress techniques could be deep breathing exercises, meditation, relaxing of your muscles, or even yoga and tai chi, or support groups can also help, as people there are going through the same as you. You could get professional support, such as counseling, and if you have any physical emotions, you should see a mental health, or rheumatology, physical therapy, or a dietitian. They can all give you professional help. When you live with arthritis symptoms 24/7, it could become very challenging. You could have developed physical, emotional, or mental health issues. There are professionals that can help you, such as stress management techniques, professional guidance, including a nutritious diet, a lifestyle changes, and keep active. With your healthcare team, family, and friends to help you, you can successfully manage your condition by easing your symptoms and therefore live a better life. I am not a medical professional and this video is for information only. If you have any worries, you should see your doctor or healthcare professional. Thanks for watching this video. If you found it helpful, then please click the subscribe button to follow my channel and press the bell. If you have any question, please leave a comment below. I hope this has helped you and good luck.